Hi, Dr. Brian McGee, physical therapist with Rexercise. So today I want to talk about ankle sprains and specifically, what exercises are best to do for ankle sprains. There's a million exercises that we could do. We really want to focus in on four main themes in our rehab for our folks who've had an ankle sprain. So number one, ankle dorsiflexion range of motion. So we tend to lose dorsiflexion range of motion as a result of a sprain, and not gaining that back is predictive of future sprains. So that's number one, dorsiflexion. Number two, ankle muscle strength. So inevitably after an ankle sprain we lose some strength, both from the injury itself where the muscles might be damaged, but also as a result of some of the immobilization that we might have had immediately post-injury. So for example, if we have a patient wear a boot for 10 days to 2 weeks approximately after their sprain, while they're at least relatively immobilized, they'll lose some strength. We want to get that back. Number three, balance training. So we lose some balance as a result of the sprain also. Some of the nerve endings that give us our sense of balance and coordination are in our ligaments. So when our ligaments are damaged, we lose some of that. We want to get that back. Also, balance training is preventative of future sprains. And last, which is really least obvious, hip muscle strength. So a lack of hip muscle strength is also predictive of future sprains. So especially in our athletes, or maybe our patients who are in a physically demanding job where sprains might be common, landscape labor, construction, we want to get hip strength back. So in this program, we're simply going to progress those parameters along a bit. So in a prior video, which I'll link in the description, we went over what I would call my phase 1 exercises. So those are for that person who just recently sprained their ankle. They're probably still wearing that boot for getting around a bit. How you doing, buddy? They're pretty sore. Their weight bearing might be restricted. Well, that person has progressed. They've been in the program maybe 2 to 4 weeks approximately. They're getting better. They're not walking around with the boot anymore. They're doing their daily, everyday, easy stuff, walking up and down stairs pretty well. But they're still having some trouble with higher level activities, working out, getting back to a sport, getting back to a physically demanding job. So in today's program, we'll simply progress that along a little bit. The exercises will get a little harder, a little more intense, we'll get a little more aggressive with our range of motion strengthening, and we'll really start the balance training in today's video. So here's the program. Okay, so the first exercise I call the toe tap. And if you stay tuned to the end, I'll summarize all of the exercises, sets, reps, all of that stuff. But again, our first exercise, the toe tap. So I've got my rubber band that if you're my patient, I've given this to you. It's secured on something. So in this case, my bench, you might shut it in a door, but there's a pretty high amount of tension on the band. I've got it around my foot. Helps to have shoes on because the rubber band sort of grabs the shoe better. If you're barefoot, it'll kind of tend to slide off of your foot. So anyway, I'm trying to keep my toes pointed forward, and I'm simply going to tap my toes up and down. Kind of fast. See if you can do 30, maybe 50 of them. It gets pretty tiring. You'll feel the muscles working on the outside of your ankle. Up and down. You'll notice how my foot wants to pull toward my left. I'm trying to prevent that. I'm trying to keep my toes pointed straight ahead toward my 12 o'clock. And that's really the hard part. So again, about 30 to 50 reps, then take a break, give it 30 seconds, 60 seconds approximately break time, and then go again. So the toe taps, this is for our ankle muscle strength, specifically the muscles that really stabilize the ankle, called the peroneal muscles on the outside of the ankle here. The next exercise, we're working on ankle dorsiflexion. I mentioned in the intro that we tend to lose ankle dorsiflexion when we have an ankle sprain or after we have an ankle sprain. And if we don't regain that movement, we're more vulnerable to future sprains. So we want to get that back. So here's one of our stretches for that. So I'm in what we call half kneeling, one knee's down, one knee's up, foot's flat. Keeping the foot flat, keeping the heel down, you're simply going to lunge forward till you feel some pull, some tension in the ankle. Hold for a few seconds. Come back. Now move at an angle toward approximately your 10, 11 o'clock. So the knee is a little bit to my left. Hold for a couple seconds. Again, I'm keeping my heel down. Come back. Now move to approximately my 1 or 2 o'clock position. Again, keeping the foot flat. So do about 12 to 15 of these. So 4 or 5 about in each direction. Okay, the next exercise is for both ankle muscle strength and balance. I mentioned that both of those, and the balance training in particular, is preventative of future sprains. So I'm going to use my foam roller to help me balance. My right side's my affected side, and I'm simply doing heel raises with a little bit of balance assist with this foam roller. Now, if you can go without a balance assist, like in my case, the foam roller, or maybe a wall or a countertop, you simply do 15 to 20 heel raises. Try to get the heel as high as you can. That's kind of the hard part, especially after a sprain. Again, 15 to 20 repetitions, 2 to 3 sets. And of course, you'll start to feel it in your calf quite a bit. But again, all the while, you're trying to balance. The next exercise, we're getting pretty aggressive with the balance. And so I have 3 medicine balls positioned at about my 12 o'clock, my 4 o'clock, and my 8 o'clock positions. It helps to have some kind of target. Solo cups are perfect for this. Or, you know, the stadium cups you bring home from the game that you accumulate over years. They're great for this, okay? So you want the targets far enough away that you have to reach a bit, but you can still maintain your balance. So my right side's my affected side. I'm balancing. You might use a balance assist like the foam roll I used before. A broom handle works okay. So I'm going to touch the front target, the back, my left target, and then reach behind for that other target. So 1, 2, 3, trying to balance all the while. You can imagine it's pretty tricky, especially if you just had an ankle sprain. Okay, 15 times. The last exercise I call the bowler squat, because it kind of looks like you're bowling. So here's my hurt side. You might start with something for a balance assist, again the foam roll, and you're simply going to squat, kind of a partial squat, maybe a quarter or third depth approximately squat. You're trying to balance, but the foam roller or maybe countertop is here to help you. And again, it kind of looks like you're doing the follow through while you're bowling. Up and down, 10 repetitions approximately. So we're working on our hip. I mentioned hip strength. Our side hip muscles, our back hip muscles have to work quite a bit with this movement, okay? Also, we're getting dorsiflexion of the ankle. So this is really, of course, balance. So we're sort of checking almost all the boxes of our exercise priorities for ankle sprain with this movement. Now, we can get a little more aggressive if we go back to our band. Okay, so our band is secured here on my bench, or again, you can shut the band in a door. So we have pretty good tension here. We're simply going to do the same movement, but now the band wants to pull my knee inward, and I have to fight that. So I'm trying to keep my knee over my foot as I do my bowler squat. So this is a pretty tough one, and this would be one of the primary exercises I would give to patients who have developed chronic ankle instability and we're trying to prevent future sprains as they return to their sport, to their job, whatever it is they do. So again, about 10 to 15 of these. That's the Phase 2 ankle sprain program. I hope you found this helpful. Please like and subscribe. So again, we did 5 exercises. The priorities of the program are increase ankle muscle strength. We use the toe tap exercise with the rubber band for that. We want to increase ankle dorsiflexion. We did the half kneeling, multi-direction ankle stretch to accomplish that. We want to increase balance and strength. We did our balance heel raises. Check that box. We want to, again, work on balance a lot with our ankle sprain. So we did the 3-way reach, both as a preventative measure and to help with recovery. And then we wanted to check all of those plus address hip strength with the bowler squat. So again, I hope you found this helpful. I hope it gets you back to what you love to do, and we'll see you next time.